Developing a well-defined upper chest is crucial for achieving a balanced and sculpted chest. However, it's not uncommon for individuals to struggle with growing this area. In this video, I'll be sharing 3 valuable tips to accelerate your progress in building your upper chest. Welcome back to another video. I'm Brendan Martinez. I'm currently getting my doctorate in physical therapy. Now, without wasting any more time, let's jump into the first tip, which is to incorporate incline pressing exercises. Due to the orientation of the muscle fibers of our upper chest, any incline pressing motion will directly stimulate it. The upper chest, or the clavicular head, is responsible for flexing and adducting the humerus, which is basically bringing your arm up and across your body. A 2020 study looked at 47 untrained men aged 18 to 30 and split them into 3 groups: an incline bench press group, a flat bench press group, and a group doing both of these exercises. All groups performed the same training volume of 1 workout per week, of 4 to 6 sets and 8 to 12 reps, and they did this for 8 weeks total. Before and after the study, the researchers measured the upper, mid, and lower chest thickness using ultrasound. And after 8 weeks, they found that the incline bench press group had the most results in upper chest growth, and they noted 62% increase as opposed to a 30% increase for the other 2 groups. And now that we understand that incline pressing exercises will have the best results for growing our upper chest, let's go over some other exercises that you can perform, because having variety in your training program is essential. Some other exercises include low to high cable flies, decline push-ups, close grip bench press, and incline dumbbell flies. However, when selecting exercises to emphasize our upper chest, it's essential to have a comprehensive training program, and you want to avoid only doing upper chest exercises. And that's going to wrap up tip number 1. Let's jump into the second tip, which is to optimize our training volume. Training volume is an area that you need to optimize if you want to see growth not only in your chest, but anywhere in the body. If you're not training your chest enough, you're ultimately not going to see the results that you want. So let's go over 2 metrics that will help us better understand how much we should be training our chest each week. These numbers are like guidelines, and the 2 that we're going to focus on is the minimal effective volume and the maximal adaptive volume, and I'll explain what both of these mean in more detail. And starting with the minimal effective volume, this refers to the minimal amount of volume that you can perform each week that will stimulate muscle growth. And in general, this number is around 10 sets per week. This can be a good starting point if you're new at the gym, because it's important to ease yourself into any new type of exercise. But it's also important to note that these are estimates and will vary slightly from person to person. But if you've been training at the gym for quite some time, you'll want to be training at a higher volume. So let's jump into the next volume measurement. Next, let's talk about the maximal adaptive volume. And this refers to the optimal volume that you perform each week to stimulate muscle growth. For the chest, this number ranges from about 12 to 22 sets per week, which is a pretty big range. But listen to your body and play around with how many sets you're performing. If you're performing 20 sets per week and you don't have debilitating soreness or muscle pain, then you're likely choosing the ideal volume for your body type. Now let's take that same scenario, and alternatively, you have severe elbow and shoulder pain and you're sore for 4 days after your last workout. You're likely choosing too high of a volume, and it's smart if you back off just a little bit. And once again, this is going to vary person to person, but using these ranges is a wise tool when you're setting up a program to optimize muscle growth. Now let's jump into the third and final tip of this video, which is to perform full range of motion. If you want to see growth, you need to throw your ego out the window. Studies have shown time and time again that full range of motion is superior for muscle growth. When we challenge our stretch muscles, this boosts muscle growth, and this is the principle of mechanical tension. The more mechanical tension that is placed on a muscle during each set and rep, the more growth that is stimulated. Full range of motion also improves your mobility and flexibility. It's going to decrease the risk of muscular imbalances, and it's going to improve your mind-muscle connection. And alternatively, partial range of motion has been shown to significantly increase your risk of injury. This likely happens because we're trying to perform exercises at a weight that's heavier than you can safely perform it, and exposes you to excessive forces that your muscles and joints are unable to tolerate. Now, I will say that sometimes partial range of motion is actually preferred. An example of this is a rehab case in physical therapy. If you don't have full range of motion at your knee following a total knee replacement, partial squats can be beneficial while working on improving that range of motion. However, for the sake of muscle growth, we should be performing the maximal amount of range of motion that we have available if you want the best results. Implementing all 3 of these tips will help transform your upper chest and help you start seeing the results you've been dreaming of. And if you're serious about developing your chest as a whole, you need to watch this video that's popping up here that will teach you how to develop your lower chest. And this will help give you a well-rounded physique.